I watch the news on COVID-19 in my scrubs every morning and tell my husband goodbye as I leave to help combat the most critical pandemic in the last 100 years. But even as I worry about patients, co-workers, and the risk of bringing this illness home to people that I love, my heart is always with my son, who is incarcerated in one of the prisons covered by the Mississippi Center for Justice lawsuit. Having a loved one locked behind those bars is far too common these days. A recent university study shows that a staggering 45% of Americans have had an immediate family member incarcerated, and Mississippi has one of the highest incarceration rates in the nation. But I'm reminded every day through my work just how far short Mississippi prisons are falling in basic protections for inmates like my son. I talk to my son on the phone, since in-person visits are not allowed right now, and what I hear is so at odds from what I know to be safe and healthy. People incarcerated spend most of their days grouped closely together, so it's impossible to maintain social distancing. They don't have basic things like masks, soap, sanitizer, and often not even clean, uncontaminated water. They have no supplies to clean and disinfect their living quarters. Seeing a doctor or nurse is extremely difficult, and testing is not routinely available. Our state leaders have spent years being tough on crime and harsh on budgets. Policies that sound good, but in fact left our prisons overcrowded, underfunded, and in desperate shape. And it's my hope that this lawsuit will spur our prisons into action, putting in place basic protections recommended by public health authorities. These are all the facts that I think about and discuss openly, and I'm determined to speak up because I know that people who look like me will listen. But when I have quiet moments to myself, how I feel is much harder to explain. In those moments, I have the broken heart of a mother who can't protect her child. When I lie down at night, the fear that keeps me awake doesn't care how I dress or what color my skin is. It's the fear of being a broken mother with a broken child in a broken system. Fear for his health and safety, but mostly fear for the future. And knowing that I'm not alone in that fear is little comfort, because it means that there are countless other mothers afraid for what's ahead for our sons and daughters if we don't find a way to bring about change.
I've been litigating prison conditions cases for years. Prisons in Mississippi compared to prisons in other parts of America, by every objective measure, are extraordinarily dangerous and deadly places. I've worked with organizations and families in Mississippi to try and raise awareness about Mississippi prisons and push the Department of Justice to investigate. At the end of last year, the looming crisis came to a head. There was an uprising. It was violent. It was fueled by systemic sort of deprivations, lack of food, lack of medical care, lack of basic safety and staffing. Many people died and were maimed. In February, the Department of Justice finally launched an investigation, and then coronavirus hit. So before the pandemic, Mississippi prisons were a breeding ground for the types of medical ailments that make people vulnerable to rapid disease progression and death due to coronavirus. Mississippi Center for Justice launched and led an investigation into coronavirus prevention practices system-wide. We found that particularly at its two largest prisons in Rankin and Greene counties, which hold 6,000 people total, there was a shocking lack of mitigation measures being taken. People inside don't have soap. They don't have enough, they can't wash their hands regularly. They don't have a way to dry their hands. They don't have enough chemicals to clean with. There's no disinfection every day in common areas or living areas. When they do have enough chemicals, they're ripping up sheets, their bed sheets, to try to wipe surfaces down, or they're using their personal bathing towels, which are unlaundered. They'll try to hand wash them, or they're using their own t-shirts. We also found that there are people that are actively reporting symptoms of coronavirus and they are not being tested or isolated. In fact, system-wide, MGOC holds over 18,000 individuals in custody, and they have only tested a couple dozen. So in May of this year, along with our partners, we filed a lawsuit in federal court against the Mississippi Department of Corrections and the heads of the 2 largest prisons. We said that they are violating the rights of people who live inside there, who have disabilities under federal disability law, and also under the Constitution, under the 8th Amendment. So along with our partners at MacArthur Center for Justice, Hogan Lowe Law Firms, ACLU, and disability rights attorney Mark Whitburn in Texas, we also filed about 2 weeks ago emergency motion for relief in this case. We hope to have an update for you soon.